And I want to thank everybody for joining us today for Children's Health in Focus, conversations we're holding with experts on timely and important health-related topics. I'm Arturo Brito, President and CEO of Children's Health Fund. So if you go to the first slide, well, that'd be great. So a little bit about today's topic. It's about boosting vaccine confidence and access. And there's a little bit of background about Children's Health Fund. We were founded more than 35 years ago with a vision that one day all U.S. children would have the comprehensive health care that they deserve and need to thrive and succeed. From our central office, we introduce innovative solutions to meeting the comprehensive healthcare needs of marginalized children throughout the United States. And then we translate lessons learned on the ground into informed policy and advocacy for all children in this country. So we lead a national network that's currently in 15 states, DC and Puerto Rico, to bring quality care to children growing up in under-resourced communities from urban to rural. Our national partners deliver services to children where they live, learn, and play through a fleet of more than 50 mobile medical clinics, telehealth, and at more than 400 schools, homeless shelters, and other community sites. Today's briefing is brought to you as part of a cooperative agreement between the Association of American Medical Colleges and the Centers for Disease Control and Prevention. The information discussed does not necessarily represent the policy of the CDC or the Department of Health and Human Services and should not be considered an endorsement by the federal government. So some facts here and some statistics. Vaccines are indisputably one of the most successful public health interventions ever. Before their development, illnesses like smallpox, polio, measles, and whooping cough, just to name a few, were common in this country as well as throughout the world, causing severe illness, lifelong disability, and sometimes death. In the United States, routine immunizations prevent 10.5 million cases of infectious diseases per year and nearly 3,000 hospitalizations every single day. Vaccines also save approximately 33,000 lives annually and prevent 720 premature deaths on a weekly basis. To date, COVID-19 vaccines have prevented more than 18 million hospitalizations and more than 3 million deaths. And I think today's topic is very timely because of the resurgence of COVID-19 with the variants, and we're going to be talking a bit about that. The CDC estimates that vaccinating of children born between 1994 and 2021 in this country will do the following. It'll prevent 472 million illnesses, including nearly 30 million hospitalizations. It will help avoid more than 1 million premature deaths, and it will save nearly $2.2 trillion in societal costs. So in 2022, Children's Health Fund's National Network partners administered more than 47,000 COVID-19 vaccines. However, rates of routine childhood vaccination have fallen in recent years, and declining vaccine confidence and growing barriers to access pose a significant challenge, particularly in underserved communities across the country, the type of communities that our national network serves. So it's for that reason that the Association of American Medical Colleges partnered with the CDC to build trust and promote confidence in COVID-19 and other routine immunizations in healthcare personnel and communities that are disproportionately impacted by the pandemic. We're not going to hear, and we're very honored to have our partners from at AAMC, the Division of Advancing Leadership and Quality, Ms. Ayanna Williams, Project Management Specialist, and Dr. Rosha McCoy, Senior Director. So Rosha and Ayanna, I'll hand it over to you to go over the next couple slides before we get into the discussion.
Thank you so much, Arturo. Really appreciate it. As Arturo said, I'm Rosha McCoy. I'm a Senior Director here at the Association of American Medical Colleges. I'm also a pediatrician by training. You know, improving access to healthcare, you can go to the next slide, is a strategic priority for the AAMC. And as you know, as we note in this word cloud, I think we all know that healthcare access is complex. It's not only thinking, I mean, it's obviously the timely use of personal health services to achieve the best health outcomes, but has so many other multifaceted issues associated with it. and is a significant source of inequity in the United States. And, at the AAMC, we know that we'll only be successful in this work if we can listen and learn from our patients, families, communities, and partner organizations like CHF and others who are here. So as part of our strategic plan, we had a unique opportunity to partner with the CDC over the last 3 years with a cooperative agreement to build confidence in vaccines, particularly COVID-19 vaccines, and then also routine pediatric immunizations. And we really believe we can use lessons learned from this work to apply to broader issues of healthcare access, particularly for historically under-resourced and marginalized communities. So over the last year, we've had the privilege of working closely with CHF and their partner organizations, all of whom, the 3 that we've been working with, are also members of AAMC, and have really been able to see up close the incredible and impactful work that's being done. So my colleague Ayanna Williams is going to tell you a little bit more about our cooperative agreement with the CDC and some of the other work we've done as part of that cooperative agreement. Ayanna?
Thank you, Rosha. Next slide, please. Hi, everybody. My name is Ayanna Williams. I'm a project management specialist here at the AAMC, Association of American Medical Colleges. On this slide, you'll see that there are 3 critical objectives for our cooperative agreement with the CDC: building trust, empower healthcare personnel, and engaging individuals and communities disproportionately impacted by COVID-19. You'll also see that we manage a number of activities for this cooperative agreement, and our partnership with the Children's Health Fund and their program partners really aligns with our goal to build trust and vaccine confidence, but more importantly, to improve access to pediatric vaccines, utilizing mobile medical clinics in areas where transportation or lack thereof is a barrier to healthcare. You'll see in the chat that Jennifer will drop a link to vaccinevoices.org, which is a microsite that we maintain that highlights vaccine efforts happening in academic medicine communities around the country. And you'll also notice that it features a video that we filmed recently in Miami. That link will also be coming soon after today's webinar. We're really excited about the work accomplished through this 6-month partnership, and we're really excited to hear from each of the program partners today. Back to you, Arturo.
Thank you, Ayanna and Rosha. We really are honored that you're here today with us today, and your partnership and that of the AAMC to increase access to vaccines and build confidence in them throughout our national network, partner communities of Phoenix, Arizona, Miami-Dade County, Florida, and Dallas, Texas. So I'm now pleased to introduce you to the leaders from those 3 sites, Dr. Lisa Gwynn, who's the medical director of the South Florida Children's Health Project, Melissa Gonzales, nurse manager of the Dallas Children's Health Project, and LaDon Dieu, clinical program manager of the Phoenix Children's Health Project. Thank you for joining us. And we're also honored to have a representative from the Centers for Disease Control and Prevention join us in the audience today. So before we jump into discussion, I do want to go over a couple of housekeeping items. We ask that you keep yourself muted throughout to avoid any background noise. If you have any questions, please post them in the chat. I'll be monitoring them throughout the discussion, and we'll get to as many as time permits, but we really do want you to ask questions. And we also want you to give us feedback on today's session, and you'll see a link to the survey in the chat. And we appreciate everyone taking a moment at the end of their presentation to complete the survey. So with that, Dr. Gwynn, Lisa, I'm going to start with you and ask you to tell us a little about the South Florida Children's Health Project and describe some of the problems of vaccine access in your community. And maybe you can also, as part of that, explain how your innovative Shots to Go program addresses those needs.
Well, thanks, Arturo, and thank you for inviting me to speak about our programs. Our project was established in 1992, shortly after Hurricane Andrew, and Dr. Redlener and Paul Simon came down and toured the devastation within our community, and we were the 5th project within the network to be established, and we've been going strong ever since. What started as a disaster response has gone on uninterrupted, And that's mainly because Miami-Dade County has a very unique population. We have a lot of people coming in from all over the world and do not always have access to healthcare. So we've been providing comprehensive healthcare as well as immunizations for the past 32 years. So yeah, that's a little bit about our project. So and as far as our Shots to Go unit, that's we refurbished one of our older units to serve as more of an immunization vehicle. We travel into schools and we also attend health fairs, a lot of community outreach and engagement. And our primary focus is to get children caught up with their vaccinations. So we just in the month of August, we administered over 2,000 vaccines. We administered just around 10,000 throughout the year. So we're busy putting shots in arms. So and we still have our medical unit as well that offers the traditional services that we always have.
Yeah, I know you're busy because I remember when I went down there for the site visit for the filming, I could not believe how many people were there waiting for their children's immunizations. And we're going to come back to you a little bit later, talk a little bit about, maybe some of the questions parents have about vaccines or hesitation, not just COVID-19, but even other vaccines. But for now, I want to turn to Melissa to tell us about the Dallas Children's Health Project. And maybe she can talk a little bit about vaccine hesitancy and describe the extent of the problem in the communities that she serves and that they serve with the Dallas Children's Health Project. So, Melissa?
Hi, Dr. Brito. Thank you for the invite. I'm Melissa, and I work for Parkland Health, which is the Dallas County Hospital. We recently started our mobile immunization outreach program April 27th of this year. We had a bit of a slow start due to timing. Many of the school nurses and the kids were not thinking of vaccines. They were finalizing their summer plans. However, we did pick up in August during the back-to-school outreach events. And in the 4 months since kickoff, we have seen roughly 673 patients. We have administered approximately 1,887 vaccines. We are Texas. We partner with the Texas Vaccines for Children program, which means that we are able to offer vaccines to children 18 and younger that are underinsured, have Medicaid, no insurance, covered by CHIP, Native American or Native Alaskan. Our current goal is we're striving to be out in the community minimum 4 days per week. And that's partnering with the independent school districts and local libraries. And also, we recently started partnering with the Boys and Girls Club around Dallas County.
Before I turn to LaDon, thank you, Melissa, for that. Before I turn to LaDon to describe the Phoenix Children's Health Project, can you talk a little bit about the kind of questions parents have about any of the vaccines, and maybe some might be hesitant, or are you experiencing that there's a lot of hesitancy in the populations that you serve in the Dallas area?
Yes, of course. So currently, our population, we see a mix of school students that are just needing to catch up on vaccines, and we also see some majority are coming from out of the country. So most of the questions are geared upon how many vaccines can they receive at one time? Is it safe to get 8 vaccines in one day because they're start overs, they've lost their vaccine records? Parents want to know if it's safe to give vaccines, primarily since they were kind of focused on COVID for a while, and they kind of just thought that it wasn't important to get their regular vaccines, especially since schools were kind of lenient on making it mandatory to where they could not return to school unless they had their vaccines. They were a little bit lenient during the pandemic. And so there was questions with parents about that. Is it mandatory? Also questions regarding just education about why they need the vaccine. We do a lot of education with the parents. Some are questions as far as like cost, if there's a fee. So with partnering with the the Texas Vaccines for Children's program, we're able to tell them, we're able to offer the vaccines at no cost to them. Really very beneficial.
I remember that being a big concern in South Florida when I was there, and the costs to get a visit, if you can get one elsewhere, is tremendous just for the visit, not to mention vaccines for those children who may not qualify for insurance, including public programs. And so, LaDon, maybe you could describe now the Phoenix Children's Health Project and populations you serve, and maybe talk a little about how you build trust within that community as part of the effort to make sure that kids receive the vaccines that they need in a timely fashion.
Absolutely. Thank you for the invite. I am LaDon Dieu. I am the clinical and program manager for Homeless Youth Outreach, and also called the Cruise and Health Mobile. One of our favorite parts is the blue buses that we're known by, which is part of the Children's Health Fund. And we provide hope and holistic health care to kids that are 0 to 24. And most of our kids are either homeless or at risk of homelessness, and they are not insured. And so we try to do our best to partner with community partners. Currently, we have over 21 partners. What we found since we've been a medical unit for about 23 years now is that we used to start at like a riverbed where there was a lot of homeless youth. But what we found over time is that it's easier to partner with, say, a resource center or a day resource center or 90-day or shelter, a domestic violence shelter, and some underprivileged schools, so that we can partner and get them more services than just medical. And it also gives us the ability to go there consistently. So we have what's kind of a Tetris board schedule where we go to 30 different clinics in 30 different locations in a month. One morning we start one location and then we go to another location. And by doing that, that helps with trust, is that we keep the same team and the same unit and the same time, so that they get used to seeing us there. And by used to seeing us there, it actually develops that trust, because all of our population has been let down by somebody in some sort or some way at some time. And there's a lot of hesitancy when it comes to medical services. We have a lot of undocumented or children that are hiding or need to be protected in some way. And so we try to be very cautious of that, and we just try to do services with trauma-informed care as best we can.
Thanks, LaDon. Something just occurred to me right now, because I think it's worth for our audience to understand, and you alluded to it, that while this session is about vaccine hesitancy and increase in access, our national network partners, like the three of you here, do a lot more for these kids. And in Phoenix in particular, when you're talking about unhoused or unstably housed children and youth, my goodness, what do you do about the heat that you've been having? You have every year, but this year has been a record year. And how do you provide care on a mobile clinic in that heat? And can you say a little bit more about, beyond the vaccines, the kind of comprehensive care that you provide to those children and youth that are unstably housed or homeless altogether?
Yep, absolutely. Heat is actually something that hits us hard in the summer. It's hard to get a mobile unit cool. And then on top of that, you have to keep, we have a lab and medications on the unit too. And so it has to be air conditioned and regulated, and it's a licensed space. In July, we had 30 days over 110, which was record-breaking heat for us. And we weren't able to keep our services all day long, but we do things a little bit differently in the summer to make it easier. So just talking about vaccines in general, we would actually send our clinical team ahead of time with a table the day before or the morning before or a different time to give education, and then schedule appointments so nobody had to wait in line. Another thing we did is we also passed out water bottles and and reusable bottles too for water, because water is so hard to keep and get in a desert. But then also when it's hot, it's a vital resource. And so we put all of our vaccine information in these water bottles, and we would go to shelters and out to the community just saying, hey, we're here, we're available. Let's help you. And then by providing that information, having a familiar face there ahead of time, making the schedule, we were able to see more kids and give them vaccines. What we also found too is we're a complete medical unit. Some of our families had to flee or run or don't have papers. So we did a lot of looking up ahead on what their vaccines are and gave them records of that information. And then we also had sick kids come, and we can't vaccinate while they're sick. So we would schedule a well child check and then a follow-up to get the vaccines. So other things we do is, like, maybe they don't want a vaccine, but we can give you the information, plant the seed, and give you a hygiene kit. Maybe we can plant the seed and give you water. Maybe you can just come in and have a spotsicle and I'll see you next week. We do things like that just in a kind way to help calm the system, because they, maybe they're fearful, and we're fearful, trauma, and we're trying to give a shot. Like, all of those things together are not their favorite thing. And so we try to be really kind about it.
Yeah, I think you just described the kind of care that we strive to provide throughout our network. It's the medical care, the mental health care, the dental care, but also those social drivers of health. And sometimes that is making sure people are well hydrated and have healthy food, and all the other social drivers of health that we know. Housing is really what you're built around here. And I know you work toward getting the children and youth that you see into stable housing and adequate housing. So thank you for doing that. And then the vaccines is an entry point, but it's not all. So Lisa, I'm going to come back to you about what you do to reach immigrants in a very diverse immigrant population throughout Miami-Dade County. I remember when I worked on the South Florida Children's Health Project, it was a challenge for many of these families to find the comprehensive health care that we provided. But we continue to follow up with them, and working off the mobile clinics was also an entry point to building that trust. So maybe you can share with us what has worked for you as of late, and maybe some of the challenges you're currently facing with the populations that you serve.
Yeah, I mean, I think reflecting 15, 20 years ago, we had more of a stable presence of families coming back for follow-up visits. What I'm seeing, or what we're seeing now in the community, is there's such a large volume of immigrant families coming through that it's kind of become this, we have a one-stop shop. It's the same faceted, multidisciplinary care. We have mental health, we have social work, but a lot of these families are doing everything in their power to get their children everything they need to get them enrolled in school. And so, believe it or not, we don't have as much vaccine hesitancy, especially for the COVID vaccine, because it's required for immigration. So that's been an interesting driver of uptake of the COVID vaccine. We don't have to talk them into it, when they have to do it for those types of reasons. So the families that we see need their well visit, they need all the paperwork for school, and they need all of their vaccines. And oftentimes they are on a catch-up schedule. So we will get them back for those reasons. But oftentimes these families haven't had a traditional medical home in the countries that they come from. So they don't really understand the concept of a medical home and the fact that they can come back. So we do a lot of counseling with the families that, look, this isn't just a one-time, one-off and you're done. Please come back. Please, these are, if we identify issues that need to be addressed at subsequent visits, we counsel the families, look, this is here for you. This is free of charge. And so they can not only get their vaccines and everything that they need for school, but they can also have ongoing care if they need it.
Yeah, I'm glad you mentioned the medical home, because really that's what we do. And some people don't really know or understand what that is. The American Academy of Pediatrics describes the medical home not as a physical place, but it's the approach one has to providing care. And there's certain criteria, but the way I like to simply define it is the kind of care that you would want your own children to receive, that comprehensive, caring, compassionate, and connected care, between primary care, mental health, and subspecialists. And I know that that's what you do in South Florida. I think sometimes there's a misconception about the mobile clinics. And clearly you're building trust in newly arrived immigrants, as well as those who've been around a long time, and others. It's not exclusive immigrants that you see or newly arrived. And that's hugely important in providing quality care. So thank you for doing that.
And I will mention also, before we move on, regarding the COVID vaccine, is that there's a lot of pediatricians in the community that are not offering the vaccine. So they come to the mobile clinic, even at my own institution. So it's fascinating. I even get emails from faculty saying, where's the mobile clinic going to be? I'd like for my child to get the COVID vaccine. So it's interesting. A city as big as Miami, you wouldn't think that that would be a problem. But in fact, for younger children that can't get the vaccine, say in Walgreens or another retail clinic, they turn to us.
Well, that's a good segue into the question I was about to ask Melissa, and she can answer, you can answer, LaDon can answer, because this came up yesterday in a discussion with one of our board members about this session. And their question was, well, wait a minute, don't the schools provide the immunizations to all these kids? If they're required, don't they? There may have been a time in some places in this country where schools did that. Melissa, do you want to talk a little about school-based immunizations, those requirements, and why there's a need for programs such as the one that you have in your communities?
Sure. So here in Dallas County, the schools, the Dallas Independent School District, the school nurses do not provide vaccines, and they do not partner with TVFC. They don't have immunizations on site. And so that's where our clinics, our stationary clinics, came in handy, because we partnered with the schools and we were on site. But there was still an issue with transportation, parents taking off of work to come to the schools to get the vaccines or come to the clinic, and then also the cost issue. So now that we have the mobile immunization unit to where we're able to come to them, we've knocked off those two reasons as to why they weren't able to be vaccinated. We do partner with I'm sorry.
No, go ahead. Let's just say,
Okay.
I get it.
So we currently partner with the school nurses, which they are able to run a delinquency report, and that's how we figure out what school we're going to go to, who has the most kids. If there's more than 80% that are unvaccinated, then of course we schedule those outreach events first. Sometimes we're able to go one day, sometimes they need us 3 to 4 days. So we're able to get scheduled. The mandated vaccines are not the issue. As Lisa mentioned, that we don't see much hesitancy there. I think one of our main barriers is the actual paperwork. It's administrative paperwork, which is parents signing the consent forms. We're able to give them the consent forms ahead of time. That way they don't have to take off of work, and they're consenting to receiving vaccines and also to participating in our MTRAC2 registry, which is the Texas State Immunization Registry. And those two, TVFC and MTRAC, those have partnered, they're merged together now, and so we have to have those consents signed before we're able to administer any vaccines. So if they're not filled out correctly or the parent forgot a signature, it's unfortunate that we cannot do a verbal consent. Like, we have to have those signed, so then we have to reschedule those students for another day. And that's been our biggest issue, the paperwork.
Thanks. Lisa or LaDon, do you want to add to that? Anything that you're doing uniquely there?
Well, in our school-based clinics, actually in our mobile clinics, now we have electronic consents. It's a QR code. So it's made life much, much easier for families. So they just have to fill it all out on their cell phone, and it works out really, really nicely.
LaDon, do you want to add anything? If not, I can go to the next.
I'm
topic.
jealous of the QR code, but no, paperwork is always a barrier. And similar to Melissa, we do try to send when we're at some schools as well. And we do send that paperwork ahead of time to try to get that. So families don't have to miss if they work, if we have younger children.
Okay. Those administrative barriers, so, right? They exist, they're real. Do you want to say something about, I know that you recently started operating a new partner site, serving unaccompanied minors for the most part, right? Do you want to say a little bit about that and what unique health needs they have? And I'm going to assume they're not vaccinated against COVID-19 or many other vaccines, but say a little bit about that.
So unaccompanied minors are children that are found by immigration that sometimes just have a piece of paper in their pocket and a date of birth or a name, but they don't have any parents or guardianship, and then they become guardians of ORR becomes their guardian. And so what we do in our clinic is we do a comprehensive care, but also vaccines and for these children. Within being received, they need to receive like a medical exam within 5 days. And so we've partnered with this organization to help get those services for these kids that come. What we find too, and because we're around the metropolitan Phoenix area is kind of big, and we partnered with so many different locations, is that often because we have trust, we're known as the blue bus. But not only these unaccompanied minors, but the kids that we do see, we find them at different locations, and they say, or we'll call the hospital and say, can we just talk to the blue bus, right? So we've seen them at our UMOM shelter, which is a domestic violence shelter. Then maybe they go to a different location and we see them a year later, or maybe they were an accompanied minor that maybe they were placed and have foster care and we can see them later. And so the cool part is that's their continuity of care a little bit is what we're trying to provide for these unhoused, unaccompanied minor children.
Thanks. I'm going to ask any of our panelists, including Rosha and Ayanna from the AAMC, if you want to answer, please feel free to chime in about, again, this is very timely because the COVID-19 variants are here and there's some concerns about that. So I want to ask about policies that are currently present at the federal or state level or local levels that are really working to improve access to childhood vaccines against COVID-19 specifically. And anybody want to jump in here, feel free to, please.
Oh, I can say a little bit about that, Arturo. I think the federal government has been reluctant to do anything more with policies, I think, because there was so much politicization of these vaccines. And so I don't expect that we'll be seeing a lot around mandates, but really trying to continue to improve access. Now, as you know, with the end of the public health emergency, all of these vaccines are now going to be treated as soon as the federal supply is used up, going to be treated like we do all other vaccines, right? So we can get them at your physician's office. They'll be charged through insurance. They'll be available through the Vaccine for Children program. The Biden administration does have a bridge program for adults who don't have insurance. So I'm also hoping over time that maybe that information about that could be available on your mobile vans or on your programs for the parents so that we can make sure they know what they have available to them potentially. So I think that's what I know. I know Lisa is also knows a lot about the immunization managers. I don't know, Lisa, if you know of anything else that they're trying around the state in various states.
No, that's pretty much it. I mean, I think immunizing adults, especially in underserved populations, is going to be a challenge. Those that aren't insured. We've had such success with immunizing families all together with the COVID vaccine. So we're going to continue to do so until we get in trouble. Good trouble. No, we're going to do our best to continue to provide that service the best that we can. until it runs out. So the supply runs out.
Yeah, I understand, Rosha, what you were saying about the politicization of this and why the federal government is a little hesitant right now, and maybe some state governments. However, the not so much a policy, but a strong recommendation from the CDC is that children get vaccinated, right? If you want to say something about that, but
yeah, we're actually in the middle of some media interviews about that. So we've been reaching out through various media markets to talk about the new updated COVID vaccine available for everyone, recommended for everyone over the age of 6 months. So really strongly recommending, as I've been saying, I think we all know somebody who's had COVID, if not ourselves recently, right?
Oh, yeah.
And we see hospitalizations going up. We see people getting ill with COVID. So immunity is waning. And so it's really important. And with the new variant, just like you said, really important before we hit winter that everybody get immunized. And in Florida, it's probably going to be year round, right? and probably Phoenix. And when you talk about, we've got the new RSV for older adults and treatment, preventative treatment for babies. Really exciting time in vaccines, I would say. But hopefully people accept it as being very fortunate and not politicize these vaccines.
Exactly. It's one of the points I made at the beginning that we're fortunate that vaccines are around. We, are a lot healthier because of them. And it is one of the greatest public health interventions ever, right? Undoubtedly, millions of lives, tens of millions of lives saved in this country, and people live healthier. I remember when I was a resident way back, when I started residency in the late 1980s, the wards were full of children who had contracted Haemophilus influenza type B, causing meningitis and other problems. And by the time I finished, because of the availability of that vaccine, you hardly saw kids with that. So, and that's in my lifetime, one specific example, but, we know historically, and COVID-19 is no exception. We're fortunate to have those vaccines available and that they were quickly developed and with all the scientific rigor that was needed. So that's great. So at this point, I think what I'm going to do, because we're running out of time here, just quickly, 30 seconds or less, I'm going to ask each of the panelists, and we'll start with you, Rosha. Just any last thoughts that you want to share with our audience about this?
Yeah, our hope is that we can use a lot of the methods, like LaDon spoke about so beautifully, about connecting with families and establishing trust, and all of you, that we can use these in the long term, right? That we can use these relationships. One, if there's ever another pandemic, that we'll be more ready than we were before. But even in the long term around mental health and a lot of the other crises that we're facing, that we can use these lessons learned and what not to do. Maybe there are lessons that we learned about how we shouldn't handle things as well for the long term. And so that's what we would love to continue to hear from all of you.
Great. Thanks. Lisa?
Well, I would just like to echo what everyone said, but also the fact that we have been very successful in offering vaccines in innovative, locations and, going where the kids are. I think that we need to continue to do that, whether it's in schools, whether it's in neighborhoods, because that's really where you establish that trust, when you're in the location in which the children are. So I look forward to continuing to do this important work. And I just want to thank everyone who has supported our programs. The AAMC, it's been a great partnership, of course, Children's Health Fund. And I look forward to continuing to vaccinate kids.
Great. Thanks, Lisa. LaDon?
I'm going to echo Lisa and say thank you. I completely agree. We appreciate your support. And what I've learned from the vaccine is that the pop-up events that we did in the education, we provided to the community, and the creative way we did it, whether it was a hygiene pack or a water bottle, really made a difference in the community. And to have numbers of vaccines, even people wanting to get vaccinated at 110 degrees, speaks volumes to the need. And we're just thankful to be able to partner and be of service to our community.
Great. Thank you, LaDon. And Melissa?
Yes, I agree, and Lisa, LaDon, and very well, and just being out there in the community and building trust with students, patients, and their parents. I think that's key. Also, just helping to educate them, reassure them, give them the information that they're hesitant on, side effects, ensuring that there is a necessity. And again, we thank our partners.
Thanks, Melissa. And Ayanna, I don't know if you want to add anything and kind of it's a bookend, Rosha from AAMC, and now you, if you want to just kind of close this out. And then we do have a question after this. We do have time for it. But if you want to add to any of this that you've heard, and thank you again for your partnership too.
Yeah, thank you to Children's Health Fund and the program partners here on the call. I think in the beginning, we started as cooperative agreement in 2020, 2021. And there was a lot of emphasis on vaccine hesitancy, rightfully so. And I think it's just important. What we're learning from this call is that not to lose the thread, that access is a really important piece to this work. And so everyone is not hesitant. There are people who do genuinely want access to vaccines, but aren't able for a variety of reasons. And I think the program partners and the work that the Children's Health Fund are making sure to close that gap. So just really appreciative for this work.
Thank you. And we appreciate you. So there is a question that came through about re-educating parents because of some misinformation that they may have received. Is this a common thing that's happening? So if any of our national network partners want to just tackle that in 30 seconds or less and answer that question. And what do you say to them when somebody's been misinformed about
Well, we have a Surgeon General that is out there saying that children shouldn't get or anybody should get the COVID vaccine. So that's misinformation starting at the very top. So we have to basically provide them with the information, the scientific information, the data, and work together to have that dialogue with the family so that they make the right decision based on facts and not rhetoric. So that's how we tackle that.
Great. Thanks.
If I could just add just really quickly, Arturo, that's something we've worked on as part of the cooperative agreement. We have health profession schools working on teaching learners how to engage with families and thinking about what the best ways are. So we're hoping to be sharing those resources soon as well.
Yeah. Great. Thanks for adding that in, Rosha. I'm hoping that the audience members are understanding how fruitful this partnership has been in such a short amount of time. We hope to find the resources to continue this partnership because we, together with you at the AAMC and our national network partners, we do so much more. And we work with these 3 partners, but we have many more around the country, like I said, in 15 states, DC and Puerto Rico. So thank you for working with us, Rosha and Ayanna, and thank you to the CDC for working with us also to make all this possible, right? This work is incredibly important to us here at Children's Health Fund. What we do here is we identify the most marginalized children growing up in under-resourced communities or hard-to-reach communities throughout the United States, from urban to rural, and we partner with on-the-ground leaders, as you can see, that are incredible. Any of us would take our children to any of them to deliver the healthcare services that children need and deserve to thrive and succeed. It's good for them, it's good for the community, it's good for the country. And then we take lessons learned on the ground, translate them into informed policy and advocacy efforts so all children in this country can benefit. We really encourage you all to reach out to us if you have any questions or would like to continue this conversation. And we are grateful for your interest and participation in today's session. And we hope that you'll be able to join us on the next Children's Health in Focus. Be on the lookout for the announcement. So thanks again, and everybody have a wonderful rest of the week. Thank you.